Hello, this is Carla DeRosa, your wellness rock star, and I'm here with my husband Paul DeRosa, and we're doing a series of educational videos and healing videos for ourselves. So thank you for watching. My husband last Sunday had a massive heart attack, sustained a lot of damage to his heart, and it was devastating to our family. He's a vegetarian, athlete, works out. We just didn't feel like, heart disease was something that our family had to worry about. And my husband's only 57. And we have 2 young kids, 11 and going to be 13 this week. So it was really quite scary. And so the purpose of this particular video is along my path of my wellness journey. I've run into some amazing doctors. When we're at Emory, Paul had some amazing doctors. Prior to Paul's event, his heart attack on last Sunday, February 26th, he went to the doctor because of chest pain and shortness of breath. And he saw our doctor with our HMO, Kaiser. And I think it was Dr. Patel. You want to say what happened?
So after I came back from Florida on vacation with our 2 daughters, I was experiencing some chest pain. It would come, maybe last about 60 seconds or so, and then go away. So I went to work the day after, and then I was still having it, and contacted Kaiser. My regular primary care physician, of course, was not available that day, but, given the level of risk factors I had, they had me see the doctor on staff that night, Dr. Patel. So, I was satisfied with that. I had the ability to, see a doctor that day rather than wait for when my primary care physician was available. So I get to see her about 5 o'clock. She can access my medical history. I had taken my yearly physical about a month prior. She has access to all my blood work and stuff, so she saw, my cholesterol levels, which were elevated. So I told her that I was getting some chest pain that came and went. Okay, so it wasn't constant. It was just like all of a sudden it hit me, and then maybe 60 seconds or so, or a minute and a half later, it would go away. And the other thing I was telling her was that I appeared to be getting fatigued over what was somewhat minimal exertions, like climbing a few flights of stairs. I know some people probably get exerted from that. But I've always considered myself to be pretty fit, so it's like a few flights of stairs shouldn't wind me. Mm-hmm. Okay.
And when he came back from vacation, driving, is when the chest pain started. Just even pulling the bags out of the car was hard for him, and he was tired and had to lay down. And so I thought that was a huge red flag. When he told me that he was having chest pains and shortness of breath, what did I say? I said, that sounds like a heart attack. You need to go see a doctor.
Right.
And and I'm not a doctor, so.
So anyway, after, I don't know, maybe 15 minutes, she checked my blood pressure. She put the stethoscope on my chest. She talked about an EKG, but I wasn't given one. And then after like I said, about 15 minutes of examination, she concluded that it was GERD, acid reflux. Told me to go get some Prevacid or, whatever generic equivalent it was. Go home, take it, and that's the deal, okay? So, I was probably not as inquisitive if I should have been, only because of the fact that no one wants to hear heart problems, heart disease, and I was probably a little bit gratified to hear that it was only acid.
And he trusted her.
So I accepted the diagnosis and left and went to the pharmacy, got my Prevacid and thought, oh, okay, give up spicy food. I figured that, well, that's going to be it, you know.
Yeah, and I mean, he trusted her as his doctor, but he's a white male, 57, elevated cholesterol. I mean, I said heart attack when he came in, kind of like offhandedly, but, you know, we definitely felt like it's something that needed to be addressed. And the fact that she didn't give him an EKG, it's perplexing. And then, what did I say? I said, well, what about the shortness of breath? So, you know, it's like you go to the doctor ignores your symptoms. Like they come up with something in their mind and then they just want to stick with it no matter what without any testing. My daughter had surgery because of GERD, and she had many tests to determine the frequency of acid, the level of acid, how far it was coming up, you know, in her esophageal. So for this doctor off the top of her head just to diagnose with no testing and no follow-up, and then 5 days later he has a massive coronary event, a heart attack. I'm enraged. I feel like the doctor dropped the ball. You know, people are always fussing at me because of my natural remedies and herbs and saying, you know, you got to go to the doctor. Well, hell, we went to the doctor. What?
Yeah, I mean, it just goes back to what we were talking about, you know, in previous videos. It's like, you know, you feel you follow the steps that you need to. Like, I mean, if I had not bothered, or if I had say, okay, well, my primary care physician is not available today. When will he be available? Oh, Monday. Okay, I'll make an appointment for Monday. You know, if I had done that, it would be like, okay, you know, then I'm completely 100% to blame because I had some symptoms and I didn't bother to do anything about it. But of course, this is the next day, and I figured, well, you know, I'm gonna see my doctor or a doctor that day. Mm-hmm. What can I say?
I know. We blame men for not going to the doctor, then to go to the doctor and the doctor doesn't listen. Then what?
Right. So
we're always responsible for our own health care, of course, but it's just maddening that a Dr. Patel at Kaiser missed this. This is so huge and so obvious and so devastating to our family. So I guess I just want to encourage healthcare workers, including doctors, to actually listen to the patient's symptoms and not just send them on their way after you think you've checked one off the list. Go through all of them, look at their history, talk to them. You know, if you could do a test that's damn near free, why not?
Well, I mean, the other thing too is like we have you know, some friends of ours who mention that when they go to the doctor, they go together. Only because if somebody may miss asking the right questions, it's possible that the other person might say, hey, you know, okay, well, you're saying it's this, but, you know, that doesn't cause this. And, you know, maybe inquiring further and putting you know, doctors more you know, their diagnosis or whatever, maybe you know, questioning it a little bit further before just blindly accepting it.
Yeah, I mean, I definitely regret not going with him, although I never go with him to his doctor. But in hindsight, I wish I was there because I would have been like, no, dear, he still has shortness of breath. Now what? And she would have been forced to re-examine her diagnosis and not be so flip about his health. So it's not to blame anyone, but it's also to say that this is a case scenario that happens every day. I've heard, you know, since this happened to Paul, people have told me that they've gone to the doctor and been turned away, told it was GERD, and had a massive heart attack and died. You know, I'm hearing these stories. So come on, doctors. If this is the #1 killer in America, if somebody comes in, don't just say GERD. Don't just turn them away. Take it to the limit. Get an EKG. Actually give them an examination. Actually follow up with them the next day to see if they're alive.
Right, exactly.